Hi, good afternoon. Thank you for joining us for June's QTECH committee meeting. We're going to get started in just a few minutes. Hello, good afternoon. Thank you for joining us for this month's QTECH committee meeting. We're going to get started in just a couple minutes. Thank you. Good afternoon. Thank you for joining us for this afternoon's QTECH committee meeting. We're going to go ahead and get started. So as we just move over to the slides for this afternoon's presentation, we want to make sure that you have an opportunity to participate in our word cloud activity for this afternoon. So in order to participate, you'll need to use your smartphone, open up the text messaging, send a message to the phone number 22333, and the message is QTECH. Once you've entered that, then you can respond to today's word cloud activity, which is what are your plans for Independence Day weekend? So as we're transitioning over the slides, you can go ahead and participate in that. As we're waiting for the slides just to switch over. Sorry, hold on one second. Okay, so we're gonna go ahead and share on this screen. Sorry about that. Okay, fantastic. Can everyone see the screen okay? I see it up on my end. So we're going to just kick off with some logistics, of course, to participate in today's session. So you've joined the session in listen only mode, so you're muted by default. But if you'd like to participate in any sort of the Q&A portion of this agenda, then you're going to make sure that you're pinned in for your telephone if you're using the telephone option for your audio today. You can, of course, continue to use a questions panel during the webinar to share any questions that you might have or feedback. And then, of course, this session will be recorded for you to revisit afterwards. So thank you for participating in today's session. We'll go ahead and transition to take a look at today's agenda. For today's agenda, we're going to go ahead and close off our electronic patient engagement learning collaborative series that we have with our partners with HITECH, Dr. Nathan Botts. So he's going to engage us through that process today, as well as taking a look at some questions he has for us all to close out those sessions. After that, we're going to transition to our Health Center Spotlight. We have the pleasure of having Caitlin Haggerty from Family Care Health Center share with us today about their social determinants of health workflow, how they've implemented it, what data they have to share on that process, and some promising practices as well. From there, we're then going to transition to listen to our CISO team. So we have the Director of CISO Services, Michael Sangili, with us today, who's going to talk about some of the recent attacks surrounding COVID-19. After that, we're actually going to transition to some announcements and wrap up, and we're going to have my colleague Diana Chavez talk about some of the diabetes efforts so we can plan in advance for that awareness month. So without further ado, I'm going to just go ahead and jump to the word cloud activity that we have to take a look at what responses have been coming in. So it looks like a lot of folks are going to be having some barbecues, some pool time, fireworks. I even see some camping. That's fantastic. So enjoy your Independence Day weekend as well. So without further ado, I'm going to go ahead and transition to our first speaker on the agenda, which is Dr. Nathan Botts. Nathan, the floor is yours, and I'll advance the slides on your behalf.
Okay, thank you so much. Let's see here. Sorry for the background noise. Okay. All right, well, welcome everyone. Thank you for joining again to this final session on electronic patient engagement. We'll be focusing in on patient portal optimization. And so appreciate having you here. As noted, please post your questions. Let me know if there's anything I can respond to. Doesn't have to be specific to this session. I know we've covered a lot of ground, and so looking forward to hearing from you all what you've gotten out of it. I'll be asking you further about that towards the end, but you're welcome to post it at any time. So next slide, please. So, just in case you're joining anew, or this is one of the first sessions you were able to catch, my name is Nathan Botts. I'm from the HITECH Center. HITECH stands for Health Information Technology Evaluation and Quality. So our focus is on adoption of health IT within health centers. We do this through training, technical assistance, and certainly our web portal at hitechcenter.org. We are a national training and technical assistance partner funded via HRSA, and we are a nonprofit, and all our services are for free. And so we, of course, work with PCAs, HCNs, and health centers directly in trying to help solve any of the issues or problems that you have surrounding health IT adoption. We cover that across many different domains. Of course, electronic patient engagement is one of them, but it also includes just general advancing of interoperability, whether related to health information exchange or adoption of EHRs or development of health IT workforce or quality improvement initiatives. We work to assist in all these areas, and so by any means, if there's something that we can help you out with, then reach out to us. Next slide, please. So as noted, my name is Nathan Botts, and I am the electronic patient engagement domain lead. It's an area I've been working in a long time, and I started off some of my initial work as founder and chief technology officer for an initiative called Health ATM. We were working in California within FQHCs across approximately 7 different health centers. And this was a while ago, and Health ATM has moved on. But at the time, had learned a lot in working with the health centers, using these technologies. We were using a kiosk-based platform. They didn't have at that time a patient portal of their own. None of them did. There was just some general, adoption of electronic health record systems. This was, closer to 10 years ago. And so, there's many barriers there, and I know that many of those barriers we're still experiencing them in our health centers, and lots of unique and complex issues to understand about our community health center population. And so I continue to work with all of you in uncovering those issues, trying to think through, ways in which we can overcome them and all learn together, because I think we can all agree that the more these tools can assist us in getting our patients activated and engaged in their health, then that much more success we'll see in their actual health outcomes and our ability to serve them. And so thank you so much for attending these sessions again. If you haven't been to previous sessions, there's 3 of them, and I believe the recording and the slides are available for you. And if you don't know where those at, I'm sure the Health Choice Network team can get them to you. So next slide, please. So we'll be looking, we've looked broadly at electronic patient engagement, talking about principles around patient engagement and patient activation, and then talking about all sorts of tools. Most of us are very familiar with patient portals and have been encouraged to use them, but I know that a lot of us are also exploring new tools to use with our patients, and whether that's for secure messaging or using it to look at lab results and other items that patient portals have provided, but maybe a bit easier for patients. That there's a number out there, and depending upon your organization, you might be looking into adopting more than others, but at a minimum, we do have the patient portal often attached to our EHRs, and so using those in a manner that can actually improve your engagement with your patients and provide them with the information they need, and do so in a way that decreases your costs and staff energy and time is what we look to do. We won't talk about specific portals. I know that we have folks on a number of different EHRs, and so we'll just be talking about some strategies and thoughts towards best practices of patient portal optimization. So next slide. So we'll talk about the benefits and the drawbacks. We'll talk about organizational considerations and adoption. We'll talk about how to increase functionality or focus in on functionalities best for your patient population, how to increase usage and accessibility of your portal, and then a wrap up of the Learning Collaborative. Next slide. So hopefully by the time we're done with this, you'll be able to identify methods for incorporating patient portal tools into your workflow. You'll be able to recognize some budget-related facets that can increase your return on investment and adoption of patient portals. And then hopefully, all of you have been pointed to or have been able to access resources on the High-Tech Center site. We have these information that covers what I'm going through with you in these slides, and then further related resources around health apps, remote patient monitoring, electronic patient engagement evaluation and assessment, adoption frameworks. And so we have a whole series of tools that hopefully you guys will be able to access and leverage for your own use and trainings. Next slide, please. So I didn't put together polls this round, but do just want to have you thinking through, as you think about where you stand in terms of portal adoption at your health center, I mean, where do you kind of place yourself? Do you feel as though, yeah, we're really using it right now, and okay, this is our time to just refine that use, or well, we've been making some effort, but boy, we really would like to see a little bit more activity and return use of our portal. Or no, I mean, we know it's there, it's been turned on, but we haven't really made a concerted effort. And so kind of think about where you sit in terms of those categories as you're participating in the session, to think through some of the strategies that we'll outline that could help you reach that next level depending upon where you sit. Next slide. So for the benefits of patient portals, let's just assume that it works, you're able to integrate it well with your EHR, and you've been generally successful registering patients. If that is done, then of course it can be great for centralizing a primary vehicle for communication with your patients. And so, it's a kind of their one-stop shop to gaining access to health records and information, education, communication with your providers. It can help them download information that maybe they want to bring to the next appointment, or update their information as needed for a next appointment. As we build out these systems, I think we're going to see increased integration with medical device APIs like blood pressure readers, glucometers, and other tools that could really help us better understand the current state of our patients' health and conditions. Of course, the drawbacks is that having worked with a number of health centers across the states, I know that portal adoption is low, and that doesn't mean people haven't turned them on, but meaning our patients haven't adopted them, and that maybe we haven't been able to derive as much value as we want to out of them. We know there's cultural and language style issues with some of the portals that don't support some of our complex and broad cultural patient needs. Some are better than others. I think 5 to 7 years ago, patient portals were not as much investment from vendors because there hadn't been as much incentive for vendors to focus on patient portals, and so they were not the flashiest things out there. I think we're seeing that change as we see policies change, and so I think we're seeing a little bit higher quality of patient portals, but that might not be the case depending upon the EHR that you're using, and that it's not just the patients, of course, that require time and effort to effectively adopt, but we also really have to have our staff well trained and engaged in supporting the workflow and promoting its use for patients. And so all of these are provide their own opportunities and challenges, of course. Next slide. Next slide, please. So one key aspect is this notion of longitudinal care, increased care continuity. This can be difficult, and we know that our patients seek and find care at different sites, and so creating that long string of understanding about the care that patients have received and their longitudinal results is extremely valuable. And it wasn't any easier when we didn't have these types of systems, but of course we have all sorts of kind of breaks in the continuity. We've been really pushing for health information exchanges, greater transparency and sharing of patient information, but we know there's challenges there across the board, both technical, both policy, both privacy and security related. But nonetheless, if we have that workflow in place and things are working, we can see, how then we can slowly start to, increase shared decision making with our patients, increase activation and engagement, and having them be a much central player in their care and the health services they receive. And so, for a patient that is working through a chronic condition, we get them signed up in the patient portal. They're able to see, some of their current labs. They're able to receive appointment reminders, maybe via text message or automated calling, coming through the portal. Instructions and different health education materials can be targeted for the patients there. It can be a great place for, we send out mailings and phone calls, but the patient portal can help consolidate all that information. And then once we get some of the bells and whistles tied in there, then they're able to actually, request or make refill for medications. They're scheduling their appointments, rescheduling appointments. They're getting short, quick answers from their providers, or the providers are getting short, quick responses from them that could have taken up a lot more staff time on the phone, etc. And so once we take the time to get those pieces in place, there's a real opportunity of both optimization of health services and cost avoidance. Next slide. I think I've covered this pretty well already. Next slide, please. So we've brought this up before. I think this is a very true statement, I believe. We have research evidence. I think we can all feel as though there's good anecdotal evidence that it can be easier to communicate via some of our portals and text messaging opportunities when we're not right there face to face. Whether it's they call the white coat syndrome, right? When we get in front of our doctors, we get a little more nervous. They're the specialists. We're trying to listen to them and take it all in. And of course, depending upon how complex our issues are and how much pain we're working through or things like that, it can be hard to ask the right questions and respond effectively. And so we found that the use of these types of tools can reduce some of those barriers and create for a better conversation around patients' actual needs. Whether it's specific to health or them simply making appointments or dealing with issues at the house or things like that. We find that people are a little more open to responding and using some of these asynchronous, right? Not at the time. Certainly synchronous is great too if we can get a hold of somebody and text message back and forth, but giving us some time to think and form our thoughts and responses, can be very valuable in communicating our needs. And so going back to our engagement and activation piece, this is a real element of empowerment for our patients. And so we see it as a good opportunity to invest in, even if at first it can be hard to identify the return on investment for it. Next slide, please. Next slide. So as I mentioned, we can see significant reduction in the amount of time that staff members are having to follow up with patients and make calls on the phone. They can, push out a lot of communications via email and text message, and likewise, lab results and tests and things like that can be, submitted. I think there was some real, caution around, misreading of the results, but many of these systems provide a lot of good education on helping patients understand what their results mean. And when we have sent out surveys, most of us, and myself included, have said, well, yeah, of course, if we're worried about our care and we get results back, it can cause anxiety, but I'd still rather know. And then I'll follow up with my doctor. But the sooner I can know, the better, as far as I'm concerned. And so, I think many respond the same way. And then we used to always have, or initially have pushback on worry that opening up, patient messaging and things like that would create this flood that would be too hard for our providers to respond to, take up too much time of our doctors. But we found that we can use this to triage, right? We're able to triage messages that are coming back from our patients that may not require, right, their clinician's time, but could be triaged by other staff members depending upon the types of requests that they're making. And this also can be triaged to understand whether it actually requires a callback on the phone, or whether it's something that can be communicated through messaging of some sort. And then again, it gives time for patients to actually process the information that they're receiving, and then come up with more cogent responses to perhaps some of the questions they're being asked about. And so, again, I think we, in previous sessions, if you remember, we looked at ways in which we were stratifying our patients' level, including elements of activation, but also elements of their overall literacy, whether digital literacy, health literacy, general literacy, that we do still have to assess that. And so, of course, for some of our patients who have greater literacy challenges, whether digital, health, or general, then of course, then we're going to stratify, and we're going to use higher touch and maybe more phone calls with those patients. But once we understand who those people are, and that some of our other patients really respond better to these tools, then that's where we can really start finding benefits in leveraging these tools and really trying to adopt them within our health centers. Next slide, please. And then likewise, it works with telehealth. And so, this element of scaffolding, with technologies and infrastructure is really important, because as we slowly build, then it helps us and our patients then leverage, further technologies and tools that we can find advantage from. We were just kind of thrown into the mix, heavily with telehealth because of the pandemic, of course. And then, but now, once some of our patients got into it, I think we found that that it could be really useful. Still has some challenges, and still, I think a lot of our patients, depending upon the types of services they need to receive and maybe their age, want that in-person contact, and our providers too, depending on what they're dealing with the patient. That in-person contact can be important. But as a first phase of finding out a patient's needs and understanding the specifics of their conditions, then we can see a real advantage in using telehealth at first. And of course, if we're working with highly rural patients who have transportation issues, then we can see a great benefit in telehealth. And then obviously, God forbid that the pandemic continues or increases again, or something similar occurs, some other type of emergency, then telehealth can provide a backup service. And so the better that we can leverage it, the greater opportunities we have to then work through our patient needs. I think whenever we use any one of these tools, just getting patients used to logging into one thing, for those who weren't familiar or as comfortable before, can help them log into another. And I've seen the tools really grow and make themselves so much easier. There can still be challenges depending upon, what our patients are trying to access those tools on, whether actual computers or using tablets or different types of phones. We know, getting that all to work 100% of the time can be difficult, but I think we're making good progress in that. Next slide, please. How am I doing on time? All right, next slide. So I think important to that scaffolding element that I was talking about, to not trying to, the term is, boil the ocean, try to solve all problems at once with a patient portal, is to focus on, the areas of high need with your patients and or the real pain points at your health center. And so is it staff time and making calls? And so, okay, if maybe the one thing you're going to really try to do is start pushing out more consistent information to your patients and doing updates via the patient portal. Or, maybe the signups with your patients is an initial barrier, but it might also be an initial barrier just getting the workflow and the communications inputted into the patient portal that gets in the way as well. And so instead of trying to roll everything out, maybe your biggest focus is simply on using it as a platform for increasing both general information as well as targeted patient information. Maybe you're working on some level of adherence, and so it could be specific to a cohort. Maybe you're working with your diabetic cohort, and you are trying to increase medication adherence. We've actually had some very specific results. I think I shared them in the last session, showing that use of patient portals with a diabetic population in pursuit of medication adherence. We've seen some good results, and significant to those results was that it was the patients who hadn't used those two tools before who we saw the greatest increase and access and adherence with. And so some great opportunities there in some of these elements. And so maybe your only focus is on medication adherence or no-shows, following up, confirming that a patient can make their appointment. I don't know about you guys, but for my current provider, I receive a notification saying my appointment's coming up, and I can text yes or no if I'm still able to make that or not. And so if I type no, then eventually I get a call back asking me, how I want to reschedule that. And so, I'm assuming many of you have encountered the same thing, and it's great for me, because sometimes those appointments pop up and I forget, or a complication comes in the way, and getting on the phone and taking care of that, all of that can keep it from success. And within all of these, we see opportunities for cost avoidance and increased revenue. We've got examples and feedback from health centers who have been able to increase payment collection through use of patient portals and services, because it's just that much easier for people to click the button to pay their bill versus getting the bill in the mail and going through that whole process. And so some great opportunities which we can focus on specifically. Wait until we get a win there or finding some success before we try to add another measure on. It might be more than our staff have time for to try to do all of these at once. And so choosing a specific one could be of advantage. Next slide, please. I think I already went through this slide, or very similar enough. So next slide, please. Yeah, next one after this. We also have some requirements right there. And so, we have reporting requirements via patient-centered medical homes and UDS that we can utilize patient portals for. We're also seeing the requirements via information blocking policy and patient right to access to their information, which provides us with a real stick to be able to provide patients with their patient portals and ensure that they're accessing those portals. These have all been kind of boiled into the view, download, transmit types of requirements that we saw in meaningful use, and we're seeing, we're not seeing those go away. We're seeing them change within, what is now promoting interoperability. But nonetheless, for many of us, getting our patient portals active and getting our patients engaged with them it is a requirement and can be helpful when we're trying to report out for some of these policies and efforts. Is there a question? Next slide, please. Yeah, I think I touched on this enough in saying that, starting small, finding small successes and building off of those can be valuable. Next slide, please. So these are some of the key portal features that we have found. And so if some of it is also a question of what things you're turning on and turning off, I think there's some pretty good guidance around things that we are interested in as patients. Being able to see our bills and pay them effectively is important. Being able to fill out pre-visit and screening forms. So I'm using, my provider uses Epic, and I have my chart. And so every time I've been able to fill out forms on my phone before I get there. And so I don't have to sit and, take the clipboard and fill out all that information that, like my name and stuff like that should already be there. It's already built into the screening forms. And so, this is such a, saves time for the patient, saves time for everybody at the clinic. And so they're great things. Of course, being able to schedule our appointments, of course, increasing communications, extremely valuable to us. And then just an overall, update of the summary of what happened and what the next steps in our care are. And so, these are the top ones. Anybody, by all means, please chat in or add to the questions or comments if there's another area that you've seen some great success in, or that your patients have been requesting. It'd be great to hear from you. Next slide, please. The one thing I'll say about this is it's interesting. I don't have the slide with me in this presentation, but it is interesting to look at what patients say they prefer as compared to what patients actually use. There can be a little difference in that. I found one big area when we looked at, for a particular project, we were looking at this very thing, patient reported preference, and then patient actual usage, and that actual usage in terms of sending messages to the care team actually ended up being the highest thing used on the site. Whereas, these similar items about being able to do appointments or read labs or do refills, were the ones that patients noted. Maybe, the communication piece was just something they assumed, but that was one shift I saw in actual usage as compared to reported preference. All right, next slide, please. So we've all run into it, and of course, some things don't work as well as we want them to, or the rollout process for registration and getting people's emails and passwords and things like that can all cause us some barriers and take time and or cause issues that people don't know how to respond to effectively when patients are calling on the phone. And so as always, it's a matter of planning, strategic planning on implementation, making sure your technical team is ready, making sure all staff, but certainly your front desk staff, making sure that they're able to field questions and provide answers and look up usernames or things like that is going to be incredibly important. And then again, paying a high attention to detail on what you actually want to roll out and what you're ready, to respond to is going to increase, the success of any of your rollouts. Creating a documentation, whether it's a notebook or a Dropbox or a single Word document that is sent out to folks that is a running log of how people take care of particular issues, I think is critical. Just making an easy place to go and look up how you respond to a problem, because we know that sometimes the documentation or the FAQs from the patient portal are less than helpful. All right, next slide, please. And I know I'm running out of time, so I'm going to kind of move towards this. This gets into that element of knowing our target cohort, understanding their needs, and rolling out our program and technologies so that it works to fill that gap. And so identifying the pain points up front is going to provide us with greater success. Next slide, please. I would just double down on training, training, training. The more confidence our staff have in using those tools, the better. And I think I already touched on the tip sheets. Next slide, please. And so let me just wrap up. But what are the ones that haven't gone well for you? It'd be great to hear. Oh, I see a chat here now. Our patients are requesting being able to pay online and book appointments, but we are worried about downstream effects of turning those on. Thank you. So, could you please, tell me a little bit more about some of the identified downstream effects that you're worried about? Is it, worried about kind of a flood of requests that are difficult to stay up with? Or what issues of paying online have you encountered or are concerned about? It'd be great to know a little bit more about that. Thank you. Next slide, please. So I want to kind of wrap it up and make sure I have a chance to answer any other questions. I've kind of run out of time, and I want to be sensitive to all the other great presentations. So if you please move forward to the last final question slide, that would be great. Yeah, so, all right, we're worried about designated slots on the template not being filled. Not sure about paying online. Maybe a disconnect and integration or more work for our billing staff. Yeah, those are great questions. Of course, for some of the kind of screening elements and things like that, there are ways to. So thanks so much, Caitlin. I appreciate the comments and the thoughts. It's going to depend on the patient portal, of course, but many of them, as you're building out your request forms, whether it's for scheduling or things like that, you're usually able to kind of check off the questions that are required and which ones are not, and hopefully that can help you take over or cover for some of those gaps in the data that you receive. But it does seem as though that probably has a lot to do with then how it's actually integrated with your appointment scheduler. The more some of them are so tightly integrated now with our scheduling and our appointment features, it provides us a good way of kind of overcoming some of those potential barriers. But I know not all are as directly integrated and take a lot more manual effort, and so understood that could be a challenge. From our examples that we've seen with some of the other sites, this payment collection piece, they found, it took time. It took 2 to 3 years before they started seeing the results, but they certainly saw some great results in the amount of payments collected. And so, those downstream effects that maybe are happening with payment, maybe, after a little more time, they'll get ironed out and easier for your billing staff to account for, but understood that there's probably some initial challenges working through that. All right, so I know I'm out of time here, so I'd like to certainly pass it over the mic to the next presenter. But thanks everyone, thanks so much. if there's any other questions I can handle, please reach out to the HCM team, or you can reach out to me directly. It'd be great to hear from you. Like I said, I'm always trying to collect lessons from the field so that I can help gather them and report back to you all, and hopefully help you as you're working through your electronic patient engagement. So thanks so much. Take care.
Thank you so much, Dr. Botts. We really appreciate your presentation and the time you've spent with us during these last couple of sessions to talk about electronic patient engagement and ways for us to enhance that. So we really appreciate.
Thank you. Thanks for the opportunity.
Fantastic. So I'm going to go ahead and transition now to our Health Center Spotlight today. So as we mentioned in last month's QTECH committee meeting, one of the things that we're tracking as part of the QTECH grant is looking at social risk factor interventions. And within that question, we realized that there was a couple different things bundled into that, right? So are you collecting social determinants of health? If you are, how are you determining a risk factor for patients based on that information, or creating that risk stratification, if you will? And then from there, tracking any sort of interventions that your team's providing to those high-risk patients. So we really wanted to take the time to have one of our QTECH committee members, Caitlin Haggerty from Family Care Health Centers, talk to us today about how their social determinant of health workflow operates, and provide a lot of insight on that. So we really appreciate Caitlin taking the time to share. So Caitlin, without further ado, the floor is yours.
Hi, everyone. My name is Caitlin Haggerty. I'm the Quality and Innovation Team Leader at Family Care Health Centers. Speaking on behalf of our community health team, we have a really robust community health team that we're proud of, so I'm excited to share their workflow with you today. Next slide, please. I might be on a delay. I don't see the next slide yet.
We have the community health team slide up. I'm thinking that there might be a delay on the
Oh,
go to.
now I see it. Thank you.
Okay, you're welcome.
In 2017, we have had community health nurses at Family Care for a long time, but then in 2017, we hired a community health team leader and added 5 community health workers. That should say 2 community health nurses to form the community health team. And now in 2021, we actually have 9 community health workers and 2 community health nurses, as well as our team leader. So we've grown a lot since we started this initiative and started screening for social determinants of health. And we have a long ways to go as well, because social determinants of health is so important. So we are excited about the growth that we've had so far. Next slide. I'm going to go ahead and pull up my presentation myself because it looks like there's a little bit of a delay. Okay, so just really quick, I'm going to go over the St. Louis, who we serve at Family Care Health Centers. We have more than half of our patients are at 100% of poverty, above the poverty line, at the poverty line or below that. A quarter of our patients are uninsured. Another 50% of our patients are on Medicaid, and about 15 to 20% of our patients are best served in a language other than English. And so all of these different social determinants right here show that we have like the rest of you, have patients that are in need of robust help from our community health team and for us to assess their social determinants. Next slide, please. Okay, so I'm going to talk a little bit before I talk about the workflow for community health workers and how they actually obtain the social determinants of health. I just want to say that our philosophy here at Family Care is that there's no wrong door. Community health workers get referrals from, they work in physically with the pediatric behavioral health team. There's take turns being they sit within physically the residency program. We have 18 residents, and so having community health workers physically in the space really helps the residents out and keeps community health workers and social determinants at the top of mind for the providers. We also have a really close relationship between the community health team and our dental department and our OB department. Especially, we have a community health worker designated for our women's health and OB department she works on specific projects for especially reaching out to Black moms and OB patients. We also have a primary care health home program here where we have care managers who huddle with our community health team for those extra high-risk patients who are on Medicaid who need tailored interventions by community health. In addition, when they have the time, community health likes to huddle with our primary care providers as well. And the provider, we'll talk about this a little bit later, but the provider has tools available to them that alert them to the fact that a patient might be a good candidate for for intervention by the community health worker. Next slide, please. Okay, so this is really small, so you might not be able to see this, but this is just a workflow of how patients get to community health. I mentioned all those departments we work with in the last slide, and basically anybody in the organization who has a connection to a patient might identify a need for the community health team, and so then they get referred. And again, no wrong door. The community health team, bless their hearts, they get referrals all kinds of ways: via Skype, instant messaging, via tasks in the health record, phone calls, in person if they're working with the OB-GYN or a residence department, they're physically co-located there, email, etc. No wrong door. So the community health team has a lot of work to do to kind of streamline all these requests, but we want to keep it as open as possible so that patients in crisis can get access to the resources they need as quickly as possible. So if the patient is in the clinic and the community health worker is available, the community health worker will do a same day. If the patient's in an active crisis, the community health worker will provide the resources and address that need right away. And then if not, and then after that crisis is at least partially resolved, that's when the community health worker performs the prepare to screen for social determinants of health, and that's when the community health worker can get a bit better picture of how the patient actually needs. And the prepare, for those of you who don't know, is I'm sure most of you do, it's in Entergy. It's a 9-question screener that asks patients different questions about that might illuminate social determinants of health. But the way our community health workers administer it is much more conversational. So instead of just asking point-by-point questions on that screener, they kind of get the patient's life story and current situation, and then kind of answer the questions in a more conversational way. And they also, in addition to the prepare, answer a self-sufficiency matrix. So basically gauging if the patient is barely surviving or if they're thriving in each of several areas of the patient's life. And so they do all of that either in a same day or via phone call. The community health workers also like to do home visits. So if you go to the next slide, Stephanie, we have a little bit more detail on what the actual interventions work, how the actual interventions work. So community health workers are experts at forming relationships with our patients. The patients share things with community health workers that they may not share with other members of this care team, because the patients see the community health workers as peers. We have hired community health workers who are model citizens in their community, that they have established relationships with community community-based service organizations, and with a lot of people in their community. And so the community health workers present themselves and are seen by the patients as peers. And so that is a crucial step in really assessing social determinants of health. And they also are really creative in their outreach. I think a lot of times family care gets bogged down by outreach because it's just a lot of phone calls to make. But Community Health, they will go and seek out a patient. They'll go to the patient's home to, if they haven't been in the clinic for a while, they'll send note cards instead of a form letter, thank you notes, or that kind of thing. Sometimes they also have gift bags filled with like toilet paper and detergent and that kind of thing that they'll leave on patients' porches or on the door of a patient's apartment. And that just creates trust between the patient and the Community Health team, and then also by the transitive property, trust in family care as a whole. So that's, we really appreciate the creativity they bring in engaging patients. And I will say the Community Health team is relentless. They will not give up on patients. If they can't get a hold of them, they'll call family members, they'll go do several home visits. They are a persistent bunch. So we're really grateful for that. Next slide. So one thing that the Community Health team, despite their growth, the one thing that we haven't done yet that we've just started to do is proactively screen for social determinants. So like I mentioned before, patients at family care don't get screened for social determinants of health until they've already been engaged by the Community Health team, and the Community Health team conducts that social determinant of health screener with the Self-Sufficiency Matrix and the Prepare. But we're exploring using Freesia to administer the Prepare. Right now, we've limited it to new MAT patients and new OB patients. And so that 9-question screener is incorporated into the new patient workflow. And we started this, I think, in April, but really in full force in May. And so we've had 107 patients engage in this interview, or in that new patient workflow with the Prepare screener included. And so our workflow right now is to have the Community Health team log into this every day and download the patient detail, and we get information in a really presentable way in the EHR that clearly outlines what patients what that patient's risks are. So if you go to the next slide, we can take a look at that. Okay, so at the top is just a screenshot of the Prepare, and you can see really clearly that patient is at risk for education and employment. And so, and it has all the questions answered. I only have a little part of the screener on here, but it lays out the Prepare in a really easy to read way so the community health worker can use that as a launching point and input the data into the EHR in a reportable way, but the conversation can be much more focused on the risks that have already been identified by the patient when they filled out the paperwork during the pre-visit planning process. And so on the bottom half of the screen, I mentioned this earlier, our providers use this pre-visit planning tool called Drives. And the nice thing about Drives is that if the patient has filled out a Prepare before, you can see on the bottom left that it has an SDOH alert section. And so it tells the provider right away if there are social determinants of health that have been identified, and that if that patient might need to be reconnected with Community Health. There's also a risk score here up on the top, and then as well as the other alerts that you classically would see in a pre-visit planning tool. But having this social determinants of health down in the bottom left is really crucial for our providers, and it's great that that is top of mind for them when they're getting ready to see patients for the day. This facilitates potentially more same-day encounters for the community health team instead of having to follow up via phone or home visit. Next slide. Oh, and one more thing I'll mention on this last slide is that the Prepare, having that Prepare in Intergy for the provider to see is really helpful as well. They typically, the way the Prepare is in the note, if you just click the boxes, is a little bit hard to read. So the providers have really appreciated having the PDF version of the Prepare so they can quickly scan and see what the patient's at risk for. Okay, next slide. So I'd like to just brag on our community health team a little bit because you can see this is the number of encounters by community health workers, and they are restless. So even during the pandemic, I mean, especially during the pandemic, we had need for community health just explode, and they saw more patients than they've ever seen before during the pandemic, and that trend keeps going up. So we're really proud of all of the work that they're doing. Yeah, they just have continued to overachieve in the last, especially in the last 12 months. Next slide. This next slide is actually data from the regional, it's a regional look at what community health workers are doing in primary care, but specifically this lines up with family care's percentages too. So most of the identified referrals have to do with housing, but we also have a lot of patients who are struggling with utilities and basic needs. And unfortunately, in about 30% of the cases, the client didn't receive services after 60 days. We're finding, especially during the pandemic, that it's easy to identify the need and connect them to the resource, but not as easy actually closing that need gap. And it sometimes will take a long time for patients to actually receive the services that they need. Next slide. Okay, so next steps is to roll out Phreesia for automatic collection of social determinants to more patients. We'd like to expand this, but as you can see, the screenings that we're already doing, we don't want to overburden our community health team. So getting them used to this new workflow of going in the system and looking at patients that were at risk that day, we want to make sure that they have time to follow up with all those patients in addition to all the open cases they already have, and incorporating like those new patients into their workflow along with all the other referrals they're getting. You can see that they're very busy. We also are exploring a pediatric specific social determinants of health screening with Phreesia. That is on the back burner for a while, but we're definitely exploring that. We know that that's a crucial part that we're missing right now because the prepare is really aimed at adults, but and when we have pediatric patients with need, the parent and the legal guardian, parent or legal guardian in the family will answer the prepare for themselves, but we think it's important to make sure we have pediatric screening as well. And then we don't have great data on the referrals that I was mentioning before. We know that regionally we're having a problem. We're having 30% of our clients not receiving the services within 60 days. But at Family Care, the collection of that data kind of fell off during the pandemic. And so we're hoping to help our community health workers document in a way that will allow us to track whether our patients are getting the services they need or not. And then we can go to our community partners with that information and then work together on finding solutions for that. I'd also like to see our community health team collect self-sufficiency data for 60-day evaluation so we can see the improvement, because I know the community health workers have quite an effect, a profound impact on our patients' well-being. And so having data to prove that would be nice, and for hopefully getting these services reimbursed by Medicaid someday. I think that's all I have. So I'm happy to answer any questions that anyone might have.
Thank you so much, Caitlin. That was a fantastic presentation. You truly highlighted the power of collecting that data and your community health worker team. So thank you so much for taking the time to share that. I'm actually going to go ahead and look at the chat for any sort of questions. I'm also going to unmute the lines if anyone would also like to ask any other questions verbally. But the first question I'm seeing here in the chat is related to the different questions you're asking. So you had mentioned that your team is collecting the prepare data. but then you also mentioned the self-sufficiency index or assessment. So could you talk a little bit more about the kinds of questions being asked? Is it just a prepared template, the self-sufficiency, both? Any other things that you might include in that process?
Great question. I'm going to actually pull up the self-sufficiency matrix right now. But in the meantime, while I'm trying to find that, basically, this is not really a screening that we administer to patients. It's really the community health worker's assessment of how the patient is doing. And so it asks questions, or it asks, like, in their housing situation, are they surviving or are they thriving? And it's a Likert scale of 1 to 5. Stephanie, I can send you this so that we can share it with the rest of our QTECH group here. But there are actually 25 different benchmarks, everything from career, childcare, stability, English language, food, income, legal issues, life skills, mental health, safety, all kinds of things. So there are a lot of, it's too much to go over right now, but I will send the tool that we give, that we have the community health workers use to assess patients, and I'll share that.
Fantastic. I think everyone will look forward to taking a look at those questions. So I'm seeing a lot of questions coming in now to the chat as well. So one of the questions that we have here is in reference to getting buy-in from providers to do the social determinant health screening of patients. Could you talk a little bit about how providers were buying into the process?
Sure. I mean, honestly, the providers love the community health team. And I think the reason we got buy-in quickly for screening more broadly for social determinants is that the community health workers have kind of demonstrated their worth, and they have testimonials from patients all the time to providers who they just say how big of an impact the community health team has had. And honestly, the other part of this is that we've kind of taken it out of the provider's hands. The provider will refer to community health if there's a big problem that's obvious that the community health workers need to be involved. But a lot of times, we're kind of taking the responsibility of screening away from the providers by doing this during the new patient workflow before the patient even gets here. And then if there is a need identified by any member of the care team, MA, nurse, front desk, BH, dental, anybody, and that gets to BH is taking on screening them for social determinants. So I think obviously everything we do for patients' well-being is directed by the primary care provider. Ideally, we're really a team in this way, and we want to alleviate the burden on the provider to remember to ask these questions and be looking out for that. And I think another thing that helps the providers is that we have that DRIVES pre-visit planning tool, and the social determinants are a part of that pre-visit planning tool. So it's right there in their face when they're planning for the visit that social determinants are top of mind.
Fantastic. And I do see a chat as well from Dr. Day, who's also saying that from her perspective as the Chief Medical Officer and with all the providers, that they really appreciate having that insight within the EHR to see exactly what's going on with the community health workers and how much they're accomplishing with the patients to address some of those factors.
That's a good point, Dr. Day, and I'll just elaborate on that a little bit, that our community health workers document everything within the EHR. So it's not just the prepare. Every encounter that the community health workers have is in the electronic health record, so a provider can go back and see notes that the community health worker has written and know what's going on with the patient from a community health perspective, all in one place.
Fantastic. And I do see some other questions going into the chat as well. So I'm going to try and summarize a couple of these. So one of them is in reference to if the need is financial in nature, how does your community health worker team assist in that perspective?
Well, financial need can look a lot of different ways. And so if the need is for housing, then we have a special grant for that. If the financial need is because they can't pay for childcare, there's special programs for that. We really rely on our community health workers to have a robust knowledge of the resources available in the St. Louis area. If they need cash I am not sure what their process is, but I think the community health worker tries to get to the bottom of what exactly is causing the financial distress and see if we can get resources to address that specific problem. And anybody else from family care, you can unmute and correct me if I'm wrong on that.
Awesome. Fantastic. So then I think another just follow-up question to that. So I'm unmuting also folks from family care as well, if you would like to chime in. So in terms of other areas, it seems like a follow-up question is just overall, how did you have leadership approve this kind of process or workflow? Because it looks like health centers are trying to implement prepare, but there's still a concern that from their perspective that providers are still liable in some sense.
I totally understand that. Our administration was, specifically our Chief Operating Officer, Lynn Kirsting, is a huge champion for community health, and she I like to say she's a healthcare prophet. She knew back in 2017 that community health was going to be huge in the next few years. And she was able to and Dr. Day as well has been an amazing advocate for community health, but those two together have been able to rally the rest of the administration and the providers to really get on board with how important social determinants are. And we have the clinical outcomes to back that up. I don't have recent data, which is why I didn't include it, but patients who have interacted with our community health team have better health outcomes. And so using that data to back up our community health team has been helpful as well. But it's hard to do that when you don't have a community health team yet. But
yeah, and I would add this. This is Caroline Day. Can you hear me?
Yes.
Yes, we can.
So when this started, we had a grant from Missouri Primary Care Association to fund them to begin with. And the leader, Jill Taylor, has just been very thoughtful to build the story in case as she goes. So she's been collecting the wins of community health workers and trying to work with a local university to, analyze data to prove the point. She's done so well herself and the team that they actually lead the ECHO through the University of Missouri Columbia on community health workers. So I think she's just known from the get-go that we need proof of this. And we're working hard, though haven't made success in getting Missouri HealthNet to start to pay for community health workers, but they really should, because we embedded them in Patient-Centered Health Home, which is a federally funded grant that's been around for a number of years for the Medicaid population. And we've been able to show the impact of community health workers in improving A1C for diabetics. It's been a team-based approach, and they've definitely been a pivotal part of that team.
That's fantastic. Thank you both sharing so much. That's key information. And I think a lot of the folks on the line are just trying to brainstorm themselves of how they can operationalize the same processes that you guys have in place. So we really appreciate you taking the time to share. Fantastic. So then I do see some other questions. We can also group these up and send them your way.
Sure.
So that you can take a look at some of the other questions that are coming in. Of course, it will be a continued conversation amongst the QTECH committee as we continue to find ways to help our other health centers operationalize similar processes. So thank you very much for that. So we're gonna now transition to our next presenter on the agenda for today, which is in relation to our CISO team and some key things to be aware of in terms of recent attacks due to COVID-19. So Michael, the floor is yours.
Thank you, Stephanie. Really appreciate it. So for those of you that haven't met me yet, my name is Michael Sangili. I am the Director of CISO Services. That's essentially our cybersecurity team. So today I just want to discuss several general attacks that we're seeing consistently throughout this whole time of the pandemic. And just some things to be aware of, so how you can take care of yourself while either working from home or out in the office. So let's get started. Next slide, please. So cyber attacks that are exploiting the pandemic. So we've seen a few attack strategies that hackers have been using to specifically target healthcare centers, especially during the pandemic. We've really come across their eye lately. And their main focus is three different things. Phishing, which is essentially those fake emails that you see them send over to you where they try to get you to give your username and passwords or maybe download some sort of file. They've been using many fake domains as well, which they are creating domains that are essentially websites, where they're creating websites that look geared towards the pandemic. A perfect example is one called summervaxcash.com, which was a legitimate website or a domain sponsored by North Carolina government, and hackers were using that domain or purchasing websites that look like the domain to lure users onto their website and perform various type of different scams on there. And lastly, of course, this is usually their main goal is financial theft. So through these different attacks, they try to gain financial gain through these attacks. So on the attack goals, we've seen 49% of the attacks are extortion based, which is typically or almost always ransomware. And what ransomware essentially is a type of malware that they put into your computer or your system. And this malware goes into your files, whether it be patient data, pictures, or any sort of files or programs. It locks these or encrypts them with a special key that the hacker has for himself. And then he leaves a ransomware note on your computer saying if it's for you to pay the ransomware of X amount of dollars in some sort of cryptocurrency, and he'll give you back your files. This is their main means of financial theft when we're talking about malware and different attacks that they do. So the way these ransomware attacks are typically delivered is through email. A simple email that may look like it's coming from your accounting department that says, hey, download this financial records for the year of 2021 or 2020. And they hope you download that Excel file that's attached to that email, open up the Excel file, and then it's typically, it's a fake email. It's a piece of malware that's inside that Excel file. It executes, propagates throughout your network, and then causes this ransomware to encrypt all of your files. And then the next attack we see, or the next reason we see these attacks is 41% is used for patient data gathering. Now, what they do with this patient data is there's a variety of things, but I'll show you on the next slide what exactly they like to target, which is a way they use patient data to make money. Let's go back to the previous slide. I'll show them this slide afterwards. So they use this patient data to make money as well, or for any financial means. And then the last 10% are just to cause disruption. At times we see them use something called DDoS, where they essentially flood your network with so much information that it crashes it, and then they can perform different nefarious activities across your network. Many times they use this. This could just be either a group of people who want to bring down a network for some reason, or it could even be just kids that are trying to, just experiment and do different bad things to networks. And we're going to talk a little more about this in a couple slides on how to prevent these type of attacks. The next one is attack delivery strategy. So we've seen that phishing is 75% of the way these hackers like to attack. And the reason they do this is because it's very simple. If they just send you an email and you download that, or you click that email, you click on a link or download the attachment, they can get into your networks and cause all kind of havoc. So that's why we always stress being aware of phishing emails and knowing how to identify and spot them. Another one is called drive-by compromise, which this can be many things, but typically it's used hit a website like that SummerVaxCash or a fake version of SummerVaxCash.com, and it could have some sort of piece of malware on there, and they hope that it could execute on your computer if maybe your computer has not been up to date, or your software, your systems have not been up to date. 10% are remote services. This is sort of the way we see attackers in movies hack. They try to look for networks out there on the internet that have IP addresses facing the internet, and they can attack you just from their home to those computers, or maybe a camera system that's logged into the internet, or some sort of software that's on the internet that they can attack. And then denial of service is that DDoS that we spoke about, where they send so much information to your network to bring it down. We spoke a little bit about the fake websites appearing to be COVID-based. Again, you always got to be wary of where you're clicking on or what website you're visiting. Always double check it and make sure you're on the legitimate website and not a copycat website that may be malicious. Lastly, we've seen organized cybercrime has increased by 1,000% since the start of the pandemic. And that number is more than likely incorrect. I'm sure it's far higher than that. We just have not identified different groups that are out there as of now. but we've seen large organizations that are cyber criminals targeting networks. We think at times that it might be just a one person or one person man team that is just targeting these networks, but in reality, there's a full organizations out there with different positions and teams that all target different networks. That's why it can be very difficult to take down some of these organizations. Next slide. So why do they steal data? Why do they want this patient information? I like to show this slide because it's very important for people to understand how grave these situations are. What this screenshot is here is a legitimate website that we got a screenshot of that shows a dark web website. And what the dark web is essentially a back part of the internet, so to speak. And this dark web website, it's almost like the Amazon of the criminal world, where they sell various nefarious items. It could be anything from weapons, guns, drugs, to patient data. As you see here in this screenshot, this is a listing for someone's information, and there's a buy it now button and everything, just like on Amazon, that says VIP healthcare. They're providing you their full info, medical records, date of birth, social security numbers, photo, insurance, drug, lab results. You name it, they have it. So this is when they steal patient data, they go onto these websites, sell this patient data, and the reason is sometimes scammers, fraudsters, they purchase this information to perform fraudulent activity against a person, and that's when you find out your social security number has been stolen or a credit card has been opened in your name. That's what they do with this patient data. That's how they make money off of this. So that's why it's very important for us to guard patient data nowadays. It's gone are the days where hackers try to go after banks. They've realized they can steal patient data, sell patient data, and be a little safer and still make large amounts of money. And this is why we stress the importance of having your systems up to date, making sure your staff has security awareness training and understands how to identify threats, not just the IT department. So I just wanted to really highlight that to show everyone what really happens behind the scenes when someone or a medical center is hacked. Next slide, please. So how can you protect yourself? In today's day and age now, unfortunately, and well, for some like to work from home, but unfortunately we have staff at home in the office, and this adds a new level of complexity to protecting patient data. So we can be working from home, and we have seen in certain networks where users unfortunately download patient data to their computers, and that is very dangerous. I know at sometimes you want to send an email or perform some sort of task where you just put it on your computer, and it's just that much easier to do, but that creates a very large risk for the patients that you're handling, or the patient information, or the confidential information that you may have. So one way to protect yourself is make sure you're always using your company sponsored equipment. If your company has not given you equipment, every IT department should be giving out company equipment so they can use it. If they are not, there should be secure ways for your staff to access patient information. So if you're part of HCN, you use Citrix, where it's a virtual environment. This is where you log into a system that looks like it's a whole nother computer you're on, and that typically should be a very secure environment to access any kind of resources, maybe your EHR or EMR, or any patient information. That's usually a secure environment. There should be extensive security awareness training conducted in your organization. We stress this almost on every call we have, because nowadays it's not just on the IT department to guard the network from threats. It's also up to the end user, the everyday user who's on their computer. This could be everything from accounting department to your nursing department. We all use email, and that means we're susceptible to someone sending over a phishing email and clicking on an item, and then downloading malware that can spread across our network. So every organization should have some sort of training that educates their staff on how to identify these threats, how to report these threats, and how to stop them right in their tracks. Again, and also everybody should have a backup procedure in place. Most organizations will provide you or educate you on their backup procedure as a backup plan. So if something were to happen, you know exactly how to react. If your computer is hacked, you know exactly who to go to. If you find something strange in your computer or some sort of weird actions happening on your computer, you should know who to report this information to. If you don't, get with your local IT department, ask them, hey, if I were to ever be hacked, where should I report this to? How should I handle this process? And this is something that an organization should develop for your staff. So if you're working in the office, and this is for more the executive team and leadership teams, you should conduct risk assessments to identify your weak areas. So your risk assessments are going to show you where your weak equipment is, any vulnerabilities you have out there, maybe out of date software that you have, or just any weak areas in general. This will give you a plan that you can tackle little by little so that you can identify the weak areas, patch those weak areas, and just make yourself feel that much better that your network is secure. So always conduct a annual risk assessment, especially being in healthcare. This is important, not only just important, actually it's mandatory. So everyone should be conducting annual risk assessments. If you're not aware of one, reach out to your IT department or your leader and ask, hey, have we done our annual risk assessments? Also, keep all systems up to date. So we stress this one many times as well because we have seen various software at medical centers that have not been updated in even years, months, days. This leaves holes for hackers to get into your network. So what hackers usually do is look for out-of-date software. If you have a Windows computer that you haven't updated in several years, that means there's definitely going to be security holes inside your system that an attacker can take advantage of. So always keep all your systems up to date. This is not just Windows, but this is also your software on your computer. If you ever see your computer tell you that you need to update, please go ahead and just update in that moment. Take those 20 minutes, 30 minutes, or maybe 1 minute to update your systems, and that'll just help keep yourself safe. Again, security awareness training. Your organization should be conducting this security awareness training every year or even monthly. At Health Choice Network and at many of our medical centers, we conduct security awareness training monthly where we send out fake phishing emails that we create ourselves. We send over to our staff to see who clicks on these emails. And if they do click on the email, we give them one-on-one training or maybe videos to watch, and we just educate them. As you go through these security awareness trainings, you'll see that from the first day you start your training, many users will unfortunately click on these emails, which could have been true malicious viruses or malwares or some sort of scams. And as you go along through this process, after several months of training users, you'll notice that users will identify these phishing emails instantly. At Health Choice Network, we went from having many users to clicking on emails to now we go months at a time without one user falling for any of our phishing emails. So it goes to show how important your security awareness training can be. And lastly, a disaster recovery plan. As an organization, you should have a plan in place where you have disaster recovery. So if you were to be hacked, you know exactly how to react. You should know where your backups for all your systems are. So if in the case of ransomware, for example, if all of your patient data was encrypted and locked by some sort of hacker, you should have a plan in place to know where you should go immediately to restore back your patient data. So you should have, hard drive space somewhere set aside that is continuously backing up your patient data or your systems, your programs, anything of that nature. So if you do get brought down by a ransomware attack, the first place to go to is to your backups, restore everything back up so you can continue seeing patients. So we want to stress that very, very important note as well. Have a disaster recovery plan and not just have one. You should perform an annual assessment of your disaster recovery plan, what we call a tabletop exercise, and run through it. Do a scenario, pretend you were hacked, and how would your team react? Sometimes we don't even tell our team we're going to do a disaster recovery testing, and we put a piece of non-malicious malware onto the environment, and then we see how they react to that malware. We see how they go to the backups and restore the backups and see how fast they're able to perform these actions. So again, we want to stress those couple of items. Make sure you have security awareness training in place, conduct your annual risk assessments, and make sure you have a disaster recovery in place. Just those three things. There's a huge list of items that you should be doing, but those three things alone will make you very secure against hackers, and it will help you keep patient data that much more secure. And we had a little bit of time, so we just wanted to identify those couple of items. I know we're running short on time, but thank you, Stephanie. If anybody has any questions, feel free to let me know. We are here to help anytime.
Thank you so much, Michael. If there's one thing always that's tattooed in our minds is think before you click. That's
Yes,
always just a part of life. So thank you so
that's
much
our
for sharing that
motto.
insight. Yeah. Thank you for sharing
Not a
that
problem.
insight. It's super important for us to keep this in our minds as well within the QTECH, knowing that one of our focus areas is, of course, data protection. So thank you for taking the time to share that with everyone.
Absolutely.
I'm going to go ahead and pass the floor to my colleague, Diana, to give us some education on the theme for this year's Diabetes Awareness Month. Diana, the floor is yours.
Perfect. Thank you, Stephanie. And I do know that we're short on time, so I'll make this quick, but we'll dive in a little deeper next month. So hello, everyone. My name is Diana Chavez, and I serve as the Diabetes Program Coordinator here at HCN. And I just wanted to remind you that November is Diabetes Awareness Month. And some of you were involved in that celebration last year, where we celebrated and highlighted the amazing work that your nurses do for the diabetic patient population. This year, however, the theme is access to diabetes care. So what we want to do is increase education, awareness of the services and all the initiatives that you have on your health centers. So basically, we are going to discuss next month what kind of initiatives you are developing currently for this year's Diabetes Awareness Month, or any other initiatives that have worked for you in the past and that you might want to share with the work group. And I'll end it there and I'll pass it to you, Steph.
Fantastic. Thank you so much, Diana. So we'll definitely keep this continuing conversation for next month's meeting so that we can get even more started in terms of planning for this event. So just to close out for today's session, I just wanted to have this up really quickly. This QR code is linked to a form submission for our Health Center Spotlight. We would like to hear from you all as part of our committee and just share any sort of education or spotlight workflow, anything you might have in place related to our QTECH topics or our grant goals and objectives. We'd love to hear from you. So that's what this QR code is for. We have a couple key events coming up within the slide deck so that you could take a look at those and register at your leisure. So thank you so much for taking the time today to meet with us all. And I hope you have a fantastic rest of your day, and we'll see you next month. Thank you.